There is very little good data on either the need for or the capacity of substance use disorder treatment and recovery services. The fact that we have such a significant problem, whether you're talking about opioids and heroin or alcohol or anything in between, and we have no data to better understand the issues themselves and the interventions that need to be put in place to address those issues is a crime. I mean, we have got to address this issue. We are not going to be able to make progress if we don't have good data. So let me tell you what we do know about need. The prevalence or the extent of substance use disorders among people, residents of the city, is pretty much the same as it is across the state. So it's about 11.3%. Another fact, close to 10% of all Boston Hospital ER visits are substance abuse related. And roughly 5% of all inpatient admissions are substance abuse related. So we're talking about a major problem. Alcohol and heroin, unfortunately, are the drugs of choice for Bostonians. The rate of alcohol abuse is very high in Boston. 25% of Boston residents report binge drinking, and 10% report heavy drinking. The rate of unintentional heroin overdoses among Boston residents increased by 76% from 2010 to 2012. And the heroin-specific calls to Boston EMS increased 25% between January and mid-November of 2013. At the state level, where there's a little more data, we can tell you that between 2000 and 2012, so between 2000 and 2012, the fatal opioid overdoses increased by 90%. And they are projected to have increased almost 50% between 2012 and 2013. These statistics are so sobering, but yet substance use disorders are preventable and they're treatable. We need to create more visibility, more awareness, more education about the disease of substance use disorders and addictions, reduce the stigma that stands in the way of so many people getting the services that they need, and develop outreach strategies to make sure that people and their families can get the services that they need when they need them. I'd now like to turn the program over to Mayor Marty Walsh.
Audrey mentioned my vision and spoke about my vision of this office. This isn't my vision. This is the families that are struggling out there that have a loved one, they don't know what to do with them. This is their vision on providing opportunities and care for people, for families that just don't have a place to go. And how do we get a message across to the press? And how do we get out into the public? And about 8 months ago, there was a fear in Boston that we were going to have an outbreak of Ebola. And we had every national press outlet cover it. We had it on the paper every day. It was in the newspaper every day. We were worried about an epidemic of Ebola breaking out in our city and people dying. And what happened? Thank God we didn't have an outbreak of Ebola. But at that same time, mothers were burying their kids. Spouses were burying their other spouse. We were losing people every single day because of a needle in an arm or alcohol or drugs. And that's happening in our country every single day. Since I've been mayor of Boston, I know families have lost loved ones. And it's an opportunity for us here in Boston to make a difference. We need to build pathways to help people recover. Or we need to build pathways and create pathways so we can prevent people from getting addicted in the first place. You know, it's a passion of mine working with the recovery community. Why? Because I know what happens when somebody gets sober.
That everybody in the city deserves that next chance. I make a point of not putting a number there because I don't think he really cares if it's your second chance. or if it's your third chance, or if you're fourth chance. There's no point in which this expires. We all agree on one thing. Everyone in this city matters. It doesn't matter what your race is, what your gender is, what zip code you live in. No one is a throwaway.